and certainly for me as well. I started this morning with a early morning call with a number of our hospitals, and I've asked Andy Thomas in a few minutes, Dr. Andy Thomas, to kind of give you a report of what that discussion was this morning, but some serious concern in regard to what's happening in regard to ICUs, and he'll fill you in on that. I next had a discussion with our health departments, and again, they're concerned certainly with the spread that they are seeing in every single county. The more upbeat news, I just got off the phone with a call with the vice president and the governors giving us different briefings, and one of the things that they spent a lot of time talking about, of course, is the vaccine that is coming. So Dr. Fauci was on the call, and he referred to it. It's just an extraordinary occurrence that this vaccine appears to be almost ready to go. So again, this is all subject to final approval, but the shipment, for example, the Pfizer could come as early as December 15th, the first shipment. The Moderna could come as early as December 22nd. Again, that's subject to approval, but we certainly are getting ready for that. And at our press conference on Thursday, I will have a full report to all of you, the people of Ohio, in regard to what we are doing, how this will roll out. So we'll be talking about that on Thursday. Some bad news. Ohio Department of Rehabilitation and Correction is mourning the deaths of 2 employees who have recently tested positive for COVID-19. Correction Officer Stephen Cook, who worked at Dayton Correctional, died on Wednesday. He had worked for the prison system since 2006. He was a father of 2. This morning, we were notified of the death of Correction Officer Mark Jones, a 27-year staff member at Trumbull Correctional Institution. He was an Army veteran. He is a father of 1. Our prayers are with both families. I want to take a moment to ask for prayers for all of those who are suffering from COVID, particularly those who are battling in our hospitals today. I have a dear friend who is battling right now. In addition to that friend, we also have our friend Mike Crabtree, who is a county commissioner in Scioto County. He is sick with COVID, is currently on a ventilator. We're praying for Mike, his wife Diane, the whole Crabtree family. And again, I would just ask everyone to pray for all those who are in our hospitals today. Let me go now to Dr. Andy Thomas. Dr. Thomas, thank you for once again joining us. I was able to join the call that you have frequently, I know, with the different hospital zones this morning, very early. And I thought after listening to that, it would be a good idea for you to report directly to the people of Ohio what you all are seeing. So I'll turn it over to you, Dr. Thomas. Thank you.
Thank you, Governor, for having me here this afternoon, representing my colleagues in the other zones, as well as colleagues around the state and hospitals, whether they're doctors, nurses, pharmacists, whoever they might be that are battling this. We've really continued on many of the same trends that we've been talking about over the last few weeks. In fact, Ohio today crossed another threshold in numbers. We crossed 5,000 inpatients with COVID in Ohio's hospitals for the first time ever during the course of the pandemic. Just back on November 1st, we were just under 1,700 patients in the state in the hospital. It's a 200% increase just since November 1st. And November 1st was a high point at that point when we began this month. Zone 2, I certainly know the data the best, and I'll tell you, we've seen a similar rise as we've talked about before. We were just under 400 patients on November 1st, and this morning we have 1,087 patients in the hospital. That's a 177% increase in just a month from what was already a record high when we started the month.
And Tom, you want to remind everybody what that zone means?
Sure. We've separated the state into 3 zones. Zone 1 is 3 regions of the state that stretch from Toledo all the way through Cleveland to Youngstown, Akron, Canton area. Zone 2, which it includes central Ohio counties up northwest towards Bell Fountain, towards Upper Sandusky, and then really regions 7 and 8 stretch. If you think 23 south, 33 south, and 70 east, that kind of southern and southeastern part of the state. And then zone 3 are essentially the Dayton and Cincinnati metropolitan areas in the counties in southwest Ohio. So we've been able to really coordinate activities amongst the hospitals in those zones on a routine basis. So for example, we have a 9 a.m. surge call every day. We've moved from Monday, Wednesday, Friday to then Monday through Friday. Now we're doing them 7 days a week, including Thanksgiving Day, as my hospital colleagues reminded me, COVID doesn't take a vacation day. So we were doing those all through the weekend. What we've continued to see in our zone is the rural areas of our zone, region 7 and 8, be hit particularly hard by this. In fact, at this point, they have between 40 and 50% of their patients that are in the ICU or on the ventilator are there because they have COVID. It's a significant issue that we're concerned about with ICU capacity, as COVID patients, as the total numbers grow, the place where especially smaller community hospitals or rural hospitals can't really expand their capacity is in intensive care. So we've heard a lot of concerns over the past couple of weeks about ICU capacity, but I think in the last just 2 or 3 days, I've heard many more hospitals in our zone really voicing concerns about their ability to continue to manage this many ICU patients, specifically because they also have staff that are out ill, nursing staff, physicians, and others. So that's leaving hospitals with really difficult decisions. A third of the patients across the entire state that are in an ICU have COVID. 1 out of every 3 patients on a ventilator across the state has COVID. That's called crowding out. They're essentially going to start crowding out other people who need that level of care if we see these numbers continue to rise. The reality is hospitals are making difficult decisions about delaying care. It may be non-emergent, non-urgent care, but it's care that might make someone after a surgery end up in the ICU. A lot of hospitals are delaying those surgeries because they can't afford to have their ICU be overtaxed. In fact, just this weekend, one of our facilities in our zone that was operating at about 130% of their normal ICU capacity, so they have been able to ramp up. They ran low on ventilators in a relatively quick fashion. Ohio State, Ohio Health, and Mount Carmel each offered, and they were able to come and pick up a handful of ventilators that got them to feel comfortable being able to continue taking patients in their ED, and if need be, needing to put them on the ventilator. So it feels palpably different when we're on our zone calls with hospital leaders around the state than it did a month ago or even a couple of weeks ago. The level of anxiety and concern. In fact, we had one hospital in the northern part of the state that had to call in a refrigeration truck because they had exceeded the capacity of their on-site morgue for patients who have passed away. So it's becoming quite serious, and we appreciate the opportunity to highlight this again with the citizens of Ohio.
Dr. Thomas, give us the guidance. I know we had folks who did get together at Thanksgiving. They may have been outside their bubble. They may have been with other people. Sometimes they may have traveled. We see on the national news all the people that traveled. What advice, I guess, is the best medical advice for those who now are maybe back? They were outside their bubble for Thanksgiving or for the weekend. What kind of advice for them?
Well, I think it's an interesting point. I've heard a number of federal officials talking about this over the weekend on television as well. Obviously, we hope that people are as safe as possible. If they did travel or got outside their bubble, if they wore a mask, if they kept their distance, and certainly we hope they were as safe as possible. To some degree, the risk that they have of getting this themselves is kind of already baked into the equation. They've already had that exposure outside their bubble or that exposure while traveling. So for them, they can't really change the risk of them getting sick. It is kind of what it is at this point. But what they can do now that they're home is make sure that, or if they're still traveling home, many people are still on the road today, that they're being as safe as possible now. So that might include taking some additional time off work to quarantine because you've been to an area that has a really high % positivity rate if you traveled out of state. Even if you went to a large family gathering, people you love, people you trust, you still are at risk of carrying that back to your community, carrying it back to your workplace, and infecting other members of your family. So it's the same things we've been asking people to do with distancing, masking, washing your hands, avoiding large crowds. But in this case, it might make sense as well for the next 5 to 7 days to really, really minimize your level of contact. So, God forbid you get sick, but at least you won't be getting anyone else sick, and you'll break that chain of transmission to other individuals.
Dr. Thomas, thank you very much. Eric, let's go to the data slide, please. We'll start with the hospital slide, since Dr. Thomas was talking about our hospitals. As you can see now, we are at 5,060 actually in the hospital. So that is basically the number of people in the hospital today from COVID. Of those, 1,180 are in the ICU. Let's go to the key indicators, Eric. This is our normal indicator number. Last 24 hours, 6,631 cases. That's lower than it's been running. What we don't know is whether that is just a result of the weekend. We hope not. We hope these numbers might be coming down, but we just don't know that yet. We are averaging 8,251 new cases over the past week. So that's 8,251 there. Eric, let's go to the top 88 counties. And again, our advice when you're trying to determine what risk there is that you might run into someone with COVID, this is a pretty good indicator. All counties are high incident counties. As you can see, even the lowest county is over 3 times the high incidence rate. So every county, obviously the counties up here, let's go to the first 10, Eric, first 20. Obviously Dark, Hardin, Lake, Miami, Allen, Marion, those are the ones that have the highest incidence. But again, every county certainly has a high incidence at this point. As we move into colder months and spend more time inside, proper ventilation and filtration is even more important to slow the spread of COVID-19. National Academies of Science, Engineering, and Medicine report, and I quote, "With effective ventilation, filtration, the number of viral aerosols can be greatly reduced." That's from COVID. End of quote. With that in mind, we have created a new program to help improve indoor air quality and reduce the transmission of COVID-19. This is aimed at our nursing homes, assisted living centers, and adult day centers, where our people are the most vulnerable. Eligible recipients can receive up to $15,000 to address indoor air quality through HVAC inspections, portable air filtration systems, new filtration systems, maintenance on current systems, and other interventions. This $20 million program is being administered by the Bureau of Workers' Compensation, which has experience administering millions of dollars a year to help employers improve workforce safety. Additionally, the Ohio Department of Aging will be working with nursing homes, assisted living centers, and adult daycare centers to promote these critical funds. For more information about this new program that we're announcing today, please visit the BWC website at www.bwc.ohio.gov. It's the BWC website. A number of people across Ohio have been able to work from home since the pandemic because of this great increase in cases. We are asking employers and employees to continue doing that. And if some have returned to work, we're asking them to take a hard look at this and see whether they could go remote again. we have to do everything we can during this very serious time when our hospitals are really being hit to slow down the transmission, slow down the contacts, the potential contacts that people might have. We are going to be doing that. We're trying to lead by example. We're doing that with state employees as well. So we had originally stated that beginning January 4th, state employees would start returning to work in stages. We are now putting a hold on that. Today, we're going to hear from some people who are really at the front lines. Let me start with our next guest, Stacy Morris. She is a nurse manager for one of the COVID units at the Cleveland Clinic, Akron General. Stacy and her nursing team are with patients from the time they're admitted as they fight to survive and in the worst circumstances when they say goodbye to those that they love. Stacy, tell us a little bit about, well, first of all, thank you for what you do, and thank you for joining us. And just tell us, if you can, what you are seeing in your unit.
Thanks, Governor, for having me. In the unit, day to day, it's been really rough over the past 3 weeks, especially. Our numbers have just risen so quickly and so drastically. We've had to work to triage our beds to make space for the patients and make sure that we have enough room for them. And that includes medical, surgical, and ICU beds. It's really a hard thing to watch. Something that we've noticed since March is that how quickly these patients deteriorate. That's been a really sharp learning curve for us, is seeing that they'll just be on a couple liters of oxygen, when they're first admitted, and then requiring a lot more oxygen very quickly, and then an ICU bed just within hours. And I think the unpredictability of that virus and the piece of it, that's the scary part, is we never really know how somebody's going to respond to this virus, what their body's going to do. We've had people in their 30s and 40s that have no medical, history that do really poorly with this. And, we wish we knew why, and we wish we could target it. We have treatments, but there's no silver bullet. There's no magic bullet to treat this right now. And that's the part that's always worrisome with this virus.
Tell us a little bit about from a kind of a human point of view. I mean, you're used to dealing with patients, but in this case, you have patients who can't see anybody besides you and the other people who are attending them. Sometimes you're able, I guess, to do a Skype, I guess they can do with their family members. Can you just give us some insight into that? Because that's not the normal thing that you see.
Yeah. So normally before this virus, people could have visitors come and see them. Their loved ones could be with them. Due to the risk of transmission of the virus, there's no visitation. So, the caregivers do their best to go in with an iPad with the patients, and they'll meet with them over the iPad to Skype. But it's a hard conversation. It's a hard thing to see over an iPad, to see your loved one like that when you just really want to be with them. And I know that that's a really heavy piece on the caregivers here too. The team holding that iPad, listening to those conversations, typically those are private conversations that happen amongst loved ones. And, we've become a part of that, and having to experience that at that level is just really difficult. And, when there is visitation, that means the odds aren't in your favor. When you're able to actually come in and say goodbye, and when we have to get you ready for that point, that's the scary, harsh reality of this virus is, we don't ever want anybody to get to that point, but we have to deal with that. And the caregiver team deals with that every day here. It's more uncommon to not take somebody to ICU or to have them do poorly than it is that we have a couple people, 2 to 3 every day that aren't doing well on our medical unit here.
So how do you personally and the other doctors and nurses, how do you deal with this?
I think we lean on each other a lot. I know we do, because it's a really amazing supportive team here. Emotionally support each other and carry each other through this. I just know that the team here is amazing and provides amazing care. but there's only so many of us to give that care. You can always get more equipment, build more space, put more beds, but there's not just hundreds of thousands of nurses and doctors and respiratory therapists just waiting in the wings. That we've been trained for years medically to care for patients at high acuity levels that they have right now with this virus, and you can't replicate that. You can't just snap your fingers and make more caregivers appear. There's always space, there's always equipment, but you need us, and we need the help of the people to help fight this so that we can be there for you and continue to give the care that we're giving.
Well, thank you for what you do, and thank everybody else that you work with for what they do and across the state. I can't imagine the emotional toll that it takes on you. I mean, you're seeing people, you're used to treating people who are sick, but this is, I think, would seem to be very different experience. And how do you deal? You've seen some of the things that are posted on the internet, or what people are interviewed who don't think that this COVID is serious. They don't think they should wear a mask. You have anything to say to them today?
I just want people to take it seriously, that this isn't a hoax. It's not blown out of proportion. This is our reality. And me and my team here, we live it every day coming to work. And the team here gets up every day coming in to take care of these patients. And they've been doing it since March. And while it's been coming in waves, this is one of the biggest waves we've ever seen. And we don't see an end to the growth. And we're hoping that we can come together as a state and a country to help slow this. We need to slow it like we did before. And unfortunately, we can't do that without the help of everybody. Masking, doing social distancing, hand sanitizing, all of the things that you're supposed to do.
Well, again, thank you. Thank you so very, very much. And thank you for taking time out of your busy day to, really talk to the people of Ohio. And we just are very grateful for what you do.
Thank you for having me, Governor.
Thank you. We now want to give some insight on what it's like right now inside Ohio's long-term care facilities, our nursing homes, congregate settings. Carrie Watkins is the Assistant Director of Nursing at Jenna Cross Lutheran Services in Holland, Ohio, near Toledo. Thank you for joining us. We appreciate it very much.
Thank you.
Tell us a little bit about what you're seeing every day in regard to the COVID. Again, not something that before March you were seeing, and it certainly has got to be a different thing to deal with. If you could just give us maybe some insight into what goes on and what you're seeing.
Well, we've been seeing recently a huge surge in the cases prior to this. We've been dealing with the pandemic since March. Our facility had gone through several months of being COVID-free. We did have an outbreak back in the end of August. We got through that, but we're seeing now that we're having such a higher rise of cases in the community that it's getting to the point where it's getting into all of these other nursing care facilities and taking over. No matter how much preparation you make, no matter how many things we do to do the proper infection control. We had great surveys. We've had great response of our infection control in our facilities, but it still manages to get its way in. Proper use of PPE, staff education, sanitation, all the things you do right, it doesn't make the virus go away. We've had very sad situations of losing patients, residents in our facility. For example, I remember one of my nurses came back from maternity leave, and she had been off for 2 months. She wasn't there during the outbreak that we had. She came back, and her hall that she normally took care of 22 residents for years.
I think we got problem. We've got her frozen on my screen. And Eric, what do you think? We'll come back? Okay, we'll come back. Carrie Watkins in just a moment, we hope. Let me kind of move on here. Now we're still, let me go now. Dara Pence is an ICU nurse manager at Ohio's Health's Riverside Hospital in Columbus. Her unit has cared for COVID patients since mid-March. Dara, are you on there? Hey, thank you for joining us. We appreciate it very, very much. What are you seeing there as far as your COVID patients and, what impact this is having on the hospital?
Yeah. First, thank you for having me. So we've been here since March on our unit. We were the primary COVID cohort unit for critical care. And obviously our world, as much as many others in the hospital system, were rocked with this. Our team came together amazingly well, collaborated, came up with protocols, policies, guidelines to try to work together on this and battling COVID. We have started with obviously it hitting us, then we've worked with battling stigmas of COVID, going back to business, and now we're back again with this surge. COVID is unpredictable. It's throwing curveballs. Much like Stacy said, we're seeing young, healthy people come and they are sick and they are passing. And then we see, people who check all the boxes of these comorbidities and they're being able to roll out. So it's completely unpredictable. And we just, we still don't know what the long-term effects are for our patients.
So you really can't, when someone comes in, what you're saying is it's almost like you're playing sort of Russian roulette or something. I mean, it's just, you don't really know. Maybe somebody you think may do well doesn't, and vice versa. Is that what you see?
Yeah, correct. Yeah. It definitely does not hold any biases, and it can affect all patients from all backgrounds. Definitely.
Tell us a little bit about, the fact that this is just different, that patients are dying alone, that patients can't see their loved ones, and how that impacts you, your nurses, and how that impacts, the patients who are there.
Oh yeah, definitely. So prior to CDC came out with new guidelines approximately a month or two ago, to where we were able to take down our isolation. And prior to that, we were seeing our patients sometimes in isolation 30 plus days. They would be in there 30, 40 days alone. In our ICUs and in some of our med surge units, we have the different machines that we are using to be able to have negative airflow. And this is really helpful to be able to have, be able to do different kind of breathing treatments, have them intubated, have them on BiPAP, CPAP, high flow oxygen. And these are just all different kinds of ways that we're trying to help treat these patients. But it's still lonely in there. They're still isolated. We're trying to cluster our care to take care of these patients, but also take care of ourselves and our teams. We do use Zoom, much like what Stacy said with using Skype. We are using Zoom, but it's very scary because a lot of times this is the last connection that these family members have with their loved ones, or the loved ones have with their family members. These patients, we are able to have them come and visit, have visitors, but it's at the time we're doing goals of care. We're having those hard conversations with the families. And a lot of times too, on the other extreme, families don't want to come in. They're too afraid. They're too afraid to come into the hospital. They're too afraid to be exposed to COVID. And so again, having that disconnect with using Zoom instead of that personal one-on-one contact, that's what our nurses are to these patients. And they're also that lifeline to the family members. When the family members aren't there, we're making those phone calls, as well as our other healthcare teams. Our doctors are also calling the families to give them updates and have those conversations. A lot of times the families just don't understand the severity of these feelings of what's going on. And we're seeing a lot of, when we have these conversations with our patients, because we do get to know them obviously very well, the ones who aren't intubated. And, we ask them, what was going on? Where do you think you got COVID? What was, where were you at? What were you doing? And we've heard graduation parties, baby showers, funerals, weddings. And, several of them have said, I had a mask, but I put it in my pocket when I saw that everyone else didn't have a mask. And we have a thing at Ohio Health now that we're saying our president, Steve Markovich, is really pushing to have COVID courage for our staff and our teams, and to wear those masks and show that we are supportive of, what is going on in our system and in our communities, and trying to educate out there to the community to have that COVID courage and wear those masks.
Well, you and nurses across the state who are helping COVID patients, helping them fight for their life, you're seeing things that the rest of us just don't see. And so, what message would you have for, people who might be watching this today in regard to, what you would like them to do to help you and to help the other nurses who are making a difference?
Yeah. I think the big thing for us is, we have our PPE. We are so blessed here to have the PPE, to have all the things that we were scared of not having, we now have. And now our biggest fear is preparing for even more of what we're already seeing. How do we feel when we were asked, how do we feel about when we see the community? And honestly, it breaks my heart. If you think about this, we hear the tornado sirens. Now, mind you, we are in Ohio, so we do open the door to actually see if there's a tornado before we, prepare. But with tornadoes, with hurricanes, when you hear those alarms go off, you pack up, you get all your supplies you need, and you take care of yourself and your family, and you get to shelter and you get to safety to make sure that you can honestly live another day. And that is, I think, the biggest thing now for us. Run out there and go get your toilet paper, go get your masks, go get whatever you need. I would rather see us honestly run out of toilet paper and run out of dishwasher soap than see us run out of ICU beds and out of hospital beds and lose more loved ones. I wish that we could bring people here with us and have them walk through our unit. But then I don't wish anybody to ever see what we have seen, what our nurses are going through. Our team is amazing. Our team is strong, but everybody is only so strong for so long. I have a friend who is in the military, and we've talked quite a bit about this, what we've seen. And, he compares it to basically being at battle. The things that we are seeing, we are at war. We are at war with this disease, and we're going to have PTSD. We're going to be struggling with this. And if the community can come together and wear a mask, socially distance, stay at home, stay safe, and that's what's going to help get us through in the long run, then, that's all we can ask for. Because we here at the hospital are no longer the front lines. We're our last line of defense. The front line now is the community.
Wow. Well, thank you very, very much. Thank you for giving us that insight, taking us inside and kind of through your eyes, seeing what you see every day. Thank you so very, very much. Please pass it on to your whole team. We're very grateful for what you do.
Thank you.
Thanks a lot. I think we'll go now to Jamie Gear as a nurse and team leader for the COVID unit at Premier Health's Upper Valley Medical Center in Troy, which is north of Dayton. She's led a team there for 4 years. On average, there are 9 nurses she supervises each day. And in the last 3 weeks, the increase in patients they've seen has been just huge. These patients are sicker than patients were in the spring and summer. Thank you very much for joining us. We appreciate it very, very much. And what, you told us that you're seeing patients who are just more sick. What do you mean by that? And maybe just kind of tell us what you are seeing right now.
Yeah, so back in March, again, I'm probably echoing a lot of what other people are saying or the other nurses were saying, but so back in March, we were seeing 5, 10, 12 patients, but now it's evolved into so much more. As one of the other nurses had spoken of before, the patients would come in, on that 2 liters of oxygen, and so very quickly they would require 8 liters, 12 liters, 30 liters, and then onto that BiPAP and CPAP, and then ultimately on the ventilator. And it happens in such a short amount of time, it's hard for us to react. So I feel like comparing our patients now compared to back in March, they are sicker. It's not they don't necessarily have the comorbidities. We're seeing healthy individuals come in and they decline so quickly. And not only I feel like back in March it was more the elderly population. Now I feel like the COVID population has been getting younger and younger.
What would you like to tell people who in Miami Valley or people across the state? I mean, you're seeing this every day. We've heard from several other nurses, but what are you seeing that might surprise people or may not really understand or have a full appreciation for as you deal with this every single day and try to help people, try to save their lives? I tell my husband this a lot. Like, I wish that I could wear a GoPro for just 4 hours of my day for people to realize the stress that us nurses and the PCTs and our respiratory therapists go through every day. It's exhausting. It's emotional. It's emotionally heartbreaking for the patients. We have an excellent team, so we really carry each other, throughout our days. And I don't think the public truly understands what we go through every day, the heartbreak and the emotion and seeing the fear on these patients' faces. This is no joke. This is very serious. And I just want the public to realize that, it's not a hoax. This is real. This is true. And as working in the hospital, we're exhausted. So please, I want everyone to realize that. Just please take this seriously. What's the hardest thing for you and for the other professionals who are dealing with this every single day?
The pain and hurt that I see in my patients' eyes. When they're COVID positive, they're not allowed to have visitors in the hospital. They can't have their loved one hold their hand and be by their side and in their time of need. And you can see the fear on our patients' faces. That's heartbreaking. That's heart-wrenching. So as a nurse, I'm not only a nurse, I'm not only a caregiver, but I'm a friend and I'm a companion, and I try to be in the place of as a loved one. I'm not, but I do my best, and I work with a bunch of excellent nurses and a great team, and everybody really works well together, and everybody really helps each other out. And that even goes as far as crying on each other's shoulders and just being there during this stressful situation.
Well, thank you very, very much. Thank you is not very adequate for any of you, but thank you so very, very much for all of us for what you do. And thank you for giving us kind of an insight into what you see that the average person just, certainly does not see, but you see every single day. So thanks for everything that you do. We're very grateful. Thank you. I want to go back to Carrie Watkins, nurse at Jenna Cross Nursing Home in the Toledo area. Thank you for joining us again. Thanks for your patience. And
no problem.
I'm not really sure where we left off, but what else do you want to tell people of Ohio in regard to what you see as far as your patients and what you worry about every day? I mean, I would just maybe before you answer that, I would just kind of summarize, I think, something you said earlier, and that basically is that no matter how good you are, no matter how hard you try, if there's significant spread in the community, it is darn hard to keep it out of your nursing home. So
Yes,
there's a relationship between the spread in the community and what you see in your nursing home.
it's directly related. We have seen such an increase in the surge of the cases in the area. Like I said, it is getting into the nursing homes. I'm hearing stories of other nursing homes that are going through very, very difficult times. The staff are overworked, spread very, very thin. We also have, turned into an extended family for our residents. Their families aren't there daily to see them and spend time with them. And the people that they are used to sharing their daily lives with are no longer able to come in to see them any longer. So not only are we being caregivers, we're becoming the extended family to those residents while their real family can't be there. I was telling a story earlier, I know it had cut out, about my nurse that came back from the maternity leave, losing out of 22 of the residents that she called her family. She cared for them for years. Almost nearly half of them had passed away. And they didn't get discharged home. They didn't go to another room. They were gone. And the pain and the emotion that I saw in her face coming back to that, when not being there during that time, was devastating. We, as nurses and caregivers, work so hard to take care of our residents and just support one another. And people really need to realize that their actions have unintended consequences. Even if you don't have a loved one that's in a nursing home facility, you can start a chain reaction that brings it right into our buildings. The residents we care for are someone's husband, somebody's grandparent, someone's brother, could possibly be somebody's child. And these lives are worth protecting. So we really need to take the recommendations seriously. It's crucial to stop spreading the virus if we all work together and unite as one to just get this. The vaccine is coming, so hopefully we can look forward to a day where we can reunite their families with their loved ones.
Well, thank you. Thank you very, very much. I mean, I would think that because of the long-term nature, many people who you are dealing with who have COVID, you've known for a long time, and your team has known for a long time. And I'm sure they become almost like family with that relationship. And for the last 8 months, the visitation has been basically cut off. And so, that's the only family, the only connection, direct connection, that they have. So it must be particularly hard on you as well as on them.
Mm-hmm. We've also became the support for the family members because we are their line of communication. We're not only caring for them, we're also caring for the residents' families that are at home, just being supportive and trying to make it through all of this together.
Well, thank you. Thank you very much. And I want to thank everybody who's working in our congregate care settings, our nursing homes, our assisted living, for what you do out there. Because you're at the front line as well. You're dealing with the COVID. And so thank you for doing that.
Thank you very much.
Very much. Thanks for sharing what you're seeing every single day. We're ready to go to questions.
Governor, first question today is from Max Philby at the Columbus Dispatch.
Hey, Governor.
Hey, Max.
As you prepare for the COVID-19 vaccine, I'm curious, are there any short-term or long-term funding needs from the federal government that you'd like to see fulfilled, whether it be with regards to tracking or anything else?
Well, we really need a bill. And, we need Democrats, Republicans to come together, Congress, put a bill together. I know a lot of people want to get it done in Congress. The president does. It just needs to happen. Everything from allowing us to roll money over so that we don't have to make decisions in December when we really need to move that money beyond December and into next year. Unemployment, there's just many, many, many needs. I won't go through them all today, but we need to see a bill come out of Congress. And I'll talk about this, later in the week. But we need a bill. And, I'm still the optimist. I think there's a bill to be had, and I hope it can get done.
Next question is from Walter Smith Randolph at WKRC in Cincinnati.
Hello, Governor. This question is about COVID education. Will you be willing to waive the accountability standards that go with state testing, like literary assessments? If yes, why? If not, why not?
I'm not sure I understand the question. I don't know whether Andy's still on there or not. Is Andy still on? It's probably not. Is he still on? Give me that question again.
The question was, will you be willing to waive the accountability standards that go with state testing, like literary assessments?
I don't know. We'll have to look at that. Yeah, I just don't know. We'll get back to you though. Thank you for the question.
Next question is from Farnoosh Amiri at the Associated Press.
Hi, Governor. Thank you for taking the time today. So pretty much every single health official that you've brought onto this call has mentioned in some way or another how this is the worst things have ever been in Ohio hospitals and throughout the state. And unlike other states like New York and California, who dealt with pretty severe first waves, Ohio is dealing with this for the first time, it seems like, as far as hospitalizations. And the main reason for that is how aggressive you were in the beginning as far as dealing with precautions and setting up lockdowns. And so I'm wondering where we go from here as things are progressively getting worse. Many of the people on the call said they don't see an end to this until a vaccine, or possibly not even after that. So what for as far as any future plans for you in the next few weeks, as far as lockdowns or precautions, what are your plans to address this heightened wave?
Well, we know the lockdowns, can be very detrimental. We've seen that in the area of mental health, for example. We see it in overdoses for drugs. I mean, there's all kinds of bad things that go along with the lockdown. And that's what has to be always weighed. As I said last week, it is a critical time. And it's a time when we need to pull back. There is some indication that Ohioans have pulled back some. They pull back at Thanksgiving. They pull back on the day after Thanksgiving. And we did not see as much movement as we've seen before. So I'm just asking every Ohioan, pull back more. If you didn't believe that, I mean, just listen to the nurses, listen to the people who are at the front line. There's a cause and effect here to what we do. We have the ability to pull this thing back, to slow this down, to plateau. The scariest thing is when I talk to the health professionals, as Dr. Thomas said, there's no indication we plateaued out yet. No indication at all. And even if we plateaued out at this level, it's still an exceedingly high level. So we've got to actually see these cases start coming down. And there's a lag. There's a 2 to 3 week lag before a case, someone is identified with a case, they test positive, and when they might be going into the hospital, when they might be going into the ICU. So we know that what's going to happen for the next couple of weeks is sort of baked in already. It's going to happen. But even more, that should be even more incentive for all of us to really kind of pull back, stay at home, go out when you need to go out, limit your activities. Every county in this state is at 3 times high incidence level. So we've not seen anything like this in the state. Haven't seen anything like this for 100 years. So that's really what needs to happen. We need to pull back. And as I said, there's some indication that that has started and that people are pulling back. We just need to continue to do that and to do it even more.
Next question is from Danny Eldridge at Hannah News Service.
Hello, Governor. Representative Becker and a few other House Republicans have introduced articles of impeachment against you. Can you just comment on?
Yeah. I'd like for them to watch what we just watched. I'd like for them to go in and talk to some nurses who are frontline nurses who are dealing with people who are dying. I'd like for them to go talk to some family members, maybe a family that didn't believe that this could happen. Now at Christmas, there'll be one less person at their table or more. So at some point, this foolishness has got to stop. And we've just got to get, and I'm not talking about most Ohio. There's just a small number of people who just continue for whatever reason to think that this is and act as if this is some big joke and that this is all some fantasy. And I don't know how you watch these nurses or talk to them and hear them without understanding that. The vast majority of Ohioans do. There's a small number of people out there who are making a lot of noise. And I just wish that they would go spend some time talking to somebody who suffered through this, someone who sees the suffering every day.
Next question is from Laura Hancock at cleveland.com.
Hi, Governor. I have
Laura.
2 questions. My first question goes back to this verification of antigen positive cases. You've said that people are making extra calls. So what is being asked on these calls? Is there another round of testing? Can you explain what confirmation is? And then my second question is, does anyone know, I know Dr. Thomas is no longer on the call, but does anybody know more about the hospital that ordered the refrigerated truck, like where it's located, what its name is, anything like that? Thank you.
Let me see if Andy's still on there. He's off now. Okay. So I can't tell you that. We'll see what we can find out. The verification, and I'll go through this later today, or not today, but later in the week or next week in more detail. But the verification that takes place it is a verification in regard to whether this person, for example, had symptoms. So it is a personal contact that initially was felt was the proper way to do this. When early on, antigen tests were not being used as much, and we didn't have the experience with these tests, there was this added layer of verification besides the positive test. CDC has now said some time ago, that no longer do you have to do that. So we will be at some point in the very near future shifting over from that protocol that we had kept with out of caution, even though the CDC had moved on. We will now be adopting next few days the CDC's guidelines, which is that these cases go in there automatically. And again, that's consistent with what most states are doing. It's consistent with what the CDC is doing.
Really quick, being that you had a false positive test from an antigen test, do you feel comfortable with the CDC's new guidance?
Yeah, I do, but I'm not the expert, and we'll get someone on here next time to give you more details about why the CDC did this and why the CDC and why our medical people feel confident about that. But they do, and again, it's the majority of states are doing that, and the CDC did this a number of weeks ago. But we'll give you more. We'll give you more when we got a medical expert on here.
Next question is from John London at WLWT in Cincinnati.
Hey, John.
Hi, Governor. I had some questions scribbled down here, but after listening to Stacy Morris, the nurse up at the Cleveland Clinic, where she said we need the help of the people to fight this. So I've been thinking about that since you started taking questions. You say pull back more. You got the holidays coming up. People are making travel plans. So I guess the question to you, quite simply, is what must we do in December?
Yeah. Well, everybody probably could make their own list of what we all need to do. Look, number one, don't travel. It certainly increases the risk. You go to if you fly, you go to an airport. It's not being in the plane. That may be part of it, part of the risk, but there's a risk. You're coming in contact with a lot of different people when you're in that airport. A lot of people coming together. It just seems to me, I think most medical experts would say that is a very high risk proposition. I think so. That's number one. That's the easiest one. Easiest one to say. It's not easy to do in the sense if you're pulling back, you haven't seen your grandchild for 6 months or something. I'm not minimizing that at all. Very, very difficult, but that's certainly one. I think, just pulling back on what you do every day, and I talked about this a couple of weeks ago, but if everybody could take down by 20% or 25% just the contacts that they have. I mean, we're seeing in retail, and there's some good news. We're seeing people wear masks. Our team was out last week. They're out again this week. I don't have the report this week, of course, but last week they were saying 91 to 92% of the people in retail establishments, on an average, throughout Ohio, were wearing masks. That's very good, and it's much higher than we had it before. So if people are wearing masks, the additional thing is just to lower the contacts. Make the grocery list and go once a week, instead of 2 or 3 times that you might run out and pick up something, just reduce those contacts. I think further, we're seeing kids that in school that are wearing masks every day. Congratulations to all our young people who are doing that. We're seeing the teachers do that. But then sometimes, we're seeing that guard come down. Parents, allow a sleepover at their house, something like that. So look, there's, I guess I prefer to look at it as how do you do things positively for the next few months? Look at all the things we can do to stay in contact with our loved ones. Which what Fran and I did over Thanksgiving. We dropped off meals at two of our daughter's house. Fran mailed pies to 2 of our sons, and we had other ones come in and pick up food. And we were outside. We had masks on. Snow outside today. It wouldn't be great today, but you just try to do those things, and you have more contact with letters. You have more contact with FaceTime. And look, the good news is, for the first time, we know when this help is coming. I mean, we think that this is coming December 15th. Now, it may be off a day, something may happen, but the best information we can have is we're going to get the first batch somewhere around the middle of December. We hope the second company is going to come in about a week after that, and we're moving. Now, it's going to take a while to get us any kind of immunity. We know that. But within the first month, we're going to cover a lot of our most vulnerable people. Take that second month until they get the second shot. So they're not really totally, covered. They're not covered really until you get the second shot. But, help is on the way. So we just got to get across this bridge. And I just think, instead of me listing all the things people shouldn't do, I just think it's more of let's be creative and figure out the things we can do that are safe, and things that enable us to stay in touch with our loved ones, enable us to do what, things that we should be doing. I think that really is really the key.
Next question is from Haley Nelson at WSYX in Columbus.
Governor, thank you for your time. I know you mentioned you would talk a little bit more about the vaccine and the rollout here in Ohio a little later on in the week, but I was thinking a lot about the vaccine and kids here in Ohio. I don't know if there's any information you could share with us about work being done there, how this might roll out with children, any special efforts going on there, because I know certainly the science can be different when we're talking about vaccines and children and just how important it is to keep kids healthy and safe. Thank you.
Yeah, I mean, I think the most important thing, for kids is to make sure they're up to speed on all their shots, which includes flu. I mean, those are things that can happen today. Any parent out there watching this, can make sure that that child is up to date completely. I would not be fearful of going into a doctor's office. I would not be fearful of going into wherever you get these shots, whether it's your pharmacy or wherever it is. I think that's something that people can do today. Now, I'm not the medical expert. My understanding is that these have not been tested yet for children, and that will be coming. So my understanding is that children are not the most vulnerable, and they're generally not frontline health workers. So we'll start with the most vulnerable, and the frontline health workers is where we think that this, we will actually end up starting. Children, certainly we hope at some point they're going to get vaccinated. But I don't have that information at what point we might see that.
Next question is from Alex Ebert at Bloomberg.
Good afternoon, Governor.
Alex.
38 states told the Government Accountability Office that they were concerned about having enough supplies to distribute and administer the vaccines, according to a report that came out of the Government Accountability Office today. Where is Ohio in that level of concern? Are we going to lack some supplies that we need to administer the vaccines? And what did Vice President Pence tell you today on the call about what the federal government is going to do to assuage some of those concerns? Thanks.
Well, the Vice President was very optimistic, very happy that this is coming, as he should be. Every doctor, Dr. Fauci and others who were on the call were all very optimistic. So it was, as I said, it was a happy call. Now, we can't start putting shots in people's arms until we get it. But all indications are that this is coming, and it's coming, within 2 weeks roughly. So we're still assessing if we have any particular needs. The one thing that the Vice President always says on these calls is, whatever your needs are, let us know, we can help you. So we think we're moving forward. We think we have a plan. I'll discuss this in much more detail on Thursday. But we think things are moving. We're optimistic about it.
Next question is from Adrian Robbins at WCMH in Columbus.
Hi, Governor.
Hey, Adrian.
Today, New York announced that they were initiating emergency hospital measures, such as directing hospitals to identify retired staff, making plans to have 50% capacity, and confirming a 90-day PPE stockpile. It sounds like our hospitals are approaching kind of a dire place. Are these things that our hospitals are working on, or are they working on other things to prepare for the surge that we could be seeing over the next month?
Yeah, I mean, we work very, very, very closely with our hospitals. One of the things that happened early on was a relationship between us and the Hospital Association and all the hospitals, different hospital organizations around the state. We have someone on the call every morning at 6:30. I'm on often. Where we go through that. So, we have direct communication with the hospitals. The zone system that I don't think, somebody outside the, looking in may not fully understand this, but it was a new system we put together with the Hospital Association. They have 8 regions of the state, basically, and we, took 3 zones that cover the entire state, and there's a hospital lead. And, their job is to know what's going on within their region. And if there's deficiencies, if there's PPE problem, that gets worked out. So, I was on the phone with Matt Damschroeder today, talking about PPE and other things, who does this for us, who's taken that since the very beginning in March. So, we're in constant contact with them. Now, look, that does not mean you can't have a shortage. That does not mean you can't have a problem at some point. But they continue to tell me that the biggest problem they see, the biggest shortage they see is people. They're doing everything they can to pull people in. They're doing everything they can to move people over from other parts of the hospital into the COVID unit. And they're working very, very hard on that. But the number one problem, the number one challenge they tell me is people. And that's what they worry about every single day.
Next question is from Jim Oddie at WHIO in Dayton.
Hey, Jim.
Governor, I'm wondering where you might be able to get help. We've heard that some of the children's hospitals around the state have been able to help and take some patients. I'm wondering in the Miami Valley if you've had the opportunity to turn either to their facility or to their personnel for help at two great facilities locally. That's the hospital at Wright-Patterson Air Force Base and the VA Medical Center there. Can you work across the federal boundary there and get help, or is that not available?
No, we've certainly been in touch with them, and that certainly, Jim, is a possibility as we move forward. You talked about children's hospitals. I want to give a shout out to Deb Feldman, Dayton Children's. They got involved with us very early in setting up a whole unit in regard to testing, and so they are really part of our internal testing system in the state, and they've been very, very, very helpful. But, every one of our hospitals in your viewing area and across the state have been helpful, and they've worked very, very hard. And we have that very close working relationship with all of them.
Next question is from Jake Zuckerman at the Ohio Capitol Journal.
Hi, Governor. Can we get some clarity on the data backlog with COVID cases, like how large it is, when it'll patch up, and whether it's an ODH problem or an external problem? I mean, right now the website warns of an unprecedented volume of cases and thousands of reports pending review. How can we understand what's going on if there's a massive hole in the data set, and how will this improve when infection rates and testing numbers are only increasing?
Sure. First of all, there's not a massive hole. Here's where it stands now as of today. The backlog is, I believe, around 7,500. We'll check those numbers, and Eric, if someone wants to tell me those numbers are wrong, or Michael, they can do that very quickly. It's about 7,500. We looked at it today, and the backlog does continue to grow, but as soon as the systems are switched over, basically these are going to be put in directly into the system, so the count will then go up. You'll have a one-day surge, an artificial surge. We are adding to the backlog every day. So when you look at the figures, they're an understatement of the figures of cases for that day, somewhere between 500 and 1,000 under. So you can take those numbers every day and add 500 to 1,000 and not be too far off. But this is something that will get switched over as soon as the data team and the tech team, IT team have got that worked out. There will be switch over sometime in the next 10 days. And, there will no longer be a backlog, and we will be going under the CDC guidance instead of the enhanced guidance that we were going under.
Thank you. And were those 7,500 reports, are those all antigen tests?
Yeah, these are antigen tests. I'm sorry. These are antigen tests that we're talking about.
Next question is from Jesse Balmert at the Cincinnati Enquirer.
Hello, Governor.
Hey, Jesse.
My question is, from your call with Dr. Fauci and the Vice President, how confident are you that this vaccine will be effective, and how quickly will the state be able to ramp up so the average Ohioan has access to the vaccine?
Yeah, well, the answer to the second is I don't know. It depends on how fast they get it to us. They're very optimistic. What they told us is that for one of the vaccines, for example, while it looks to be about 95% effective in preventing it, it's 100% effective in regard to significantly improving outcome. So even if it didn't prevent it, it would improve the outcome. That's pretty exciting. Early on, when we talked to some of these same doctors, they were telling us, we don't know what percentage it will be effective. And I've had doctors tell me, 70 to 80% would be good. So I think when we saw the 95% numbers, 94, 95% numbers, I think everyone in the medical community, at least that I have talked to, is very happy with those numbers. So we're very optimistic about this. And look, it's been a phenomenal, as Dr. Fauci said, an extraordinary occurrence that in this period of time they could come up with vaccines that are this effective. And he went out of his way, and you'll hear this on TV at different points, I'm sure, as they talk about it. But he went out of his way to talk about the safety of it, and that this is something that once it's approved, American people should feel very, very safe in taking.
Next question is from Bennett Haberly at WBNS in Columbus.
Hey, Governor. Good afternoon.
Afternoon.
Hey, I had two quick questions. One, dovetailing off what Alex had said, I wasn't clear. Was Ohio one of those states that had expressed concern about the inability or the concern that the government might not get the vaccine out?
Yeah.
I'm not
aware. Let me just answer that. I'm not aware that we expressed that concern.
Okay. Second question, Governor, is obviously I think there'll be a number of people struck by what the nurses had to say today, but there are still people out there who don't believe in the efficacy of masks. There were some discrepancies in some of the hospital data on what the state reported versus what a nonprofit journalistic group had been able to uncover. All of that threatens to undermine what people believe. What are you as governor doing to resolve that?
Yeah. Look, we've been as transparent as we could. The first press conference we held back in March, I said that my commitment to the people of Ohio was to tell them everything we knew when we knew it. Sometimes we have to tell you it's incomplete. Sometimes we have to tell you that the medical experts are evolving. But we've been very open about that. I would say to anybody who doesn't believe the cases, they're very accurate. But if people don't want to believe them, don't believe them. Believe the hospital numbers. Go look at the number of people that are in the hospital from COVID. Now, unless you think Andy Thomas is a liar, unless people think that these other people are liars, and that every hospital in the state is in some big conspiracy and that all these people who are in there really don't have COVID, that's it. I mean, just look at the hospitalizations. Don't have to look at anything else. Look at the hospitalizations and understand that they are a lagging indicator, that it's what we're doing today which will impact where people are in a couple weeks. This is not fantasy and this is not made up. These are real nurses, these are real doctors, these are real people reporting this. I would say anybody has any doubts, just look at the hospitals, what's happening to the hospitals. Better yet, pick up the phone. If you got a friend who works in a hospital, call him at night, call her at night, call the hospital. I don't want the hospital administrators flooded, but just watch what they say on TV when they're interviewed, how they describe it.
Next question is from Jim Province at the Toledo Blade.
Hi, Governor. Thanks again for doing this. So far, the deaths that we've been seeing have not been keeping pace with the increase in new cases. This surge now, to a certain extent, is about 2 months old, and yet we still have not seen a corresponding surge in deaths. Do you still expect that to come, and why haven't we seen it so far?
Yeah, look, I can only tell you what I know, and again, medical experts are the ones to talk about that. What they have told me is that the length of stay in a hospital has gone down. The average length of stay has gone down. There are new treatments. There are no cures, but there are better ways of getting better outcomes. And I think, that has impacted the deaths. I'll look at the data, Jim. I mean, we're running a lot of deaths. It may not be in the same proportion. I would not expect it to be in the same proportion, as the number of cases, because of the improvement in the medical care and what doctors now know and drugs they have available that they did not know before. What is new is doctors' understanding of the other problems connected with people who have COVID and who get out of the hospital. They no longer are part of the data. They were a case, but they don't show up in the hospital because they're not there anymore, and they don't show up on deaths because they didn't die, but they're still on oxygen at home and these other things. I think that's something that, again, is a story that many times is not really told because it doesn't show, we don't tell it very well because it doesn't show up in any kind of data, but I think people should, that is part of the story that is out there.
Next question is from Mike Livingston at Gongwer News Service.
Hi, Governor. Just wondering, when are we going to see your veto of Senate Bill 311? And also, just how concerned are you about further attempts to restrict your authority moving forward, especially as we hit the peak of lame duck here very soon? Thank you.
Well, again, I would just ask anybody, to just look at what's going on in our hospitals. I mean, this is certainly not a time that we want to be taking away the health department's authority to deal with a crisis. I mean, this is just not the time to do that. This is very, very serious.
Next question is from Ben Schwartz at WCPO in Cincinnati.
Hi, Ben.
Hi, Governor. To stay on the articles of impeachment really quickly, I'm just wondering, has the backlash from some members of the Ohio legislature regarding COVID restrictions had any effect on your decision making during the pandemic? And with these articles of impeachment being filed, do you see it having any effect moving forward? Thank you.
No. Look, I mean, I don't want anyone to misunderstand that. Legislators are an equal branch of government, and I consult with them and I talk with them. I talked to a legislator right before I came on here. I'm going to talk to a couple more when I finish the press conference. So it doesn't mean that, we don't consult, we don't talk. But I have to make these decisions, based upon what I think is best. That's my sworn duty.
Next question is from Jess Harden at mahoningmatters.com.
Hi, Governor.
Hi, Jess.
As you've said repeatedly, most Ohioans and most businesses are following the rules. I've got a question about a business that isn't, though. Top Notch Diner in Cortland currently displays a sign informing customers that it does not enforce the mask mandate for customers or employees. The diner was also the site of a civil disobedience rally Saturday, attended by about 30 people protesting your quote unquote tyrannical public health measures. The diner further pledged to stay open until 11 p.m. Saturday in direct violation of the curfew. The Trumbull County Combined Health District has received 45 complaints about the diner being in violation of pandemic-related health issues. Yet on Saturday, police did nothing and the prosecutor did not step in. Why should businesses follow your directives if there are no effective penalties, especially in this case? And what do you say to your critics who are following the rules and local health officials who are frustrated by lack of cooperation and with situations like these?
Well, I guess what I would say to businesses that are following the rules, I'd say thank you. And, what they are doing is saving lives. That's number one. That's the most important reason to do it. It saves lives, not because the health department orders it, I order it. Most important is because it clearly saves lives. As far as this particular establishment, we'll talk Trumbull County Health Department and we'll deal with it.
Next question is from Pete Grieve at Spectrum News.
Governor Dr. Anthony Fauci said yesterday, and I quote, "Close the bars and keep the schools open." That's his seems to be his guidance to New York, but also to other states, given the surge in cases nationally. It occurs to me that in many parts of Ohio, we sort of have the opposite situation where the bars are open and the schools are either never open for in-person learning or have had to scale back due to the rising cases. I'm wondering if you can sort of react to Fauci's comments, and is it time to close the bars in Ohio?
I don't have any comment about that today. As far as Dr. Fauci, I have a great deal of respect for him. Whenever he comes on TV, I listen to him, see what he has to say, as I do other experts who are on. And, we have a lot of conversations with experts all across the country. What's happening with schools thus far is that schools, we are seeing more schools that are going remote. Department of Education takes this survey every Thursday, once a week. And when we looked at the last data, as you would expect, we're seeing as this virus continues to flare up, just as nursing homes can't keep it out of nursing homes or have a hard time doing it, when you're 10 times the high incidence rate or even 3 or 4 times, it's the same problem with schools. And schools are doing a good job. Teachers are doing a good job. Administrators, office personnel, the kids are doing a good job. But it is very hard to keep it out of schools. And what's happening is that schools, we've left it to the schools and to the parents to make the decision about what the kids and whether they go remote or hybrid or whether they go in person. But what's happened is more and more, the further along we go in the last few weeks, more and more schools have pulled back either for a week, 2 weeks, or sometimes until after the first of the year. And they've done so because they can't put teachers in the classroom, they can't put bus drivers driving buses, or they've got a whole bunch of kids who are quarantined. So this is something that is naturally, organically happening around the state, not based on our orders, but rather on the reality that these schools are seeing.
Next question is from Karen Kassler at Ohio Public Radio and Television.
Hey, Karen.
We'll come back to Karen. Last question is from Luis Gill at Ohio Latino Television.
Hey, Luis.
Hello, Governor. How are you?
I'm well, sir. Thank you.
Good. Governor, if I may, I would like to make a statement because this situation that we're having in our state and the country is very serious. And, I had taken it serious from the beginning, but you take it more serious when you see friends and you see family members going through this terrible thing. And you see friends within a week that they lose 10 to 15 pounds because they feel that they don't want to eat, they feel chills, they feel vomiting. I mean, there's so many things. I also spoke with a friend of mine that has a friend at Tufts University doing a PhD. And the doctor, they indicated that this virus is so horrible, intelligent, that it will latch into your body on your weakest part of your health, so it will be complicated. And those are the things that you pay attention when it comes to close friends, close family members, and so on. So those are the things that I would like, to listen to the nurses and all the stuff. It verifies, everything you've been saying and that you would like to do. I personally have overcharged or overdrive my use of mask, my distance, my air hugs with friends. So in that way, I can protect myself and protect them at the same time. And you minimize, visitors and stuff like that, because, even though it is true, but if it wasn't true, why not take care of yourself, or why not help each other and so on. So that was a little statement that I would like to make, Governor, because, it is a fine line that you're working. It is, hard to please a lot of people. And those are the things that, I pray for you that, you come up with good answers every time you have this press conference, because it's not easy. I understand that. So I do have a question, Governor. the super spreaders, those meetings, weddings and funerals and the students. How transparent are those tests that you do to the young people? Because this doctor, they indicated to me, that friend of mine, that he's seen 28s, 32, 40s, 50s all dying, and he resides in Miami. So how transparent are those numbers on the super spreaders here in Ohio, of those students, young people, and that they perhaps, those are the things that need to focus, because I do see business trying to do the best they can, even though I heard that reported indicating one business now, doing the things that he must do to cooperate. Those are the things that people are asking.
Yeah, thank you very much. Thanks for that statement. Super spreader events, in those we can tell, where it occurred. What we normally see now, though, with such widespread in the community, is we see many times that they can't figure out, the person doesn't know where they got it. The super spreader events, what they generally have in common is they're inside, and people are crying, singing, talking loud, something like that, and they're in together for an extended period of time. As far as kids, what we're seeing is, in regard to kids, we're doing testing now in schools. We hope within the week or so to have some data back, at least preliminary data, to show what is actually occurring inside the classroom. And so we'll have some more information on that. So let me close. November has been National Adoption Month. In Ohio, we have over 3,000 children who are eligible for adoption and are waiting for a family to love them. Alex, who you're going to hear from right now, is one of them.
My name is Alex, and I'm looking for a forever family. I like coloring. My favorite subject is math.
So Alex is a really good kid. He's a very articulate child. He's really intelligent.
4 spades is a card.
He likes school. He's very inquisitive. He likes to learn things. He likes to know about things. Right now, we have 37 children that are in the permanent custody of the agency that we are searching for family, for an adoptive home for them.
Is the card in column 1, 2, 3, or 4?
They're all really good kids, and they all come from places of trauma, and that affects their behaviors. But they're good kids. They're just like normal kids. And at the end of the day, all they really want is a family to love them. And this family that he had been with since he was like 14 months old wanted to adopt him, and they did adopt him. But as Alec grew older, his behaviors increased.
I feel like my whole family didn't really understand, what I was kind of going through, and why I did the things I did. I wanted a family that I have bond time with. I wanted a family that cares, that does the steps to help me. I wanted a family that would go places. And I know I'm probably going to have problems, but I hope you understand. I'm just looking for someone, because I've been looking in and out of places.
Every child deserves a chance. And when you adopt or foster these kids, you are giving them an opportunity to grow to be a wonderful adult. So ultimately, our goal for Alex is adoption. So he's ready. He's ready to move into a family that will love him and care for him.
I want a family that I want to live for the rest of my life.
Well, Alex, thank you very, very much for sharing your story with us. We're very, very grateful. If you're interested in fostering or adopting a child, please visit fosterandadopt.jfs.ohio.gov. That's fosterandadopt.jfs.ohio.gov. Thank you all very much.